Okay, medication tips and hints. So let's talk about this for a few moments. There's a few things that you ought to know for the NCLEX, and these tips will be helpful in your nursing experience as well. So insulin. Now I have a whole other lecture that's entirely dedicated to insulin, so you'll make sure you want to listen to that one as well, but I'm going to just throw this in here because it does fit as well. When you are drawing up insulin, you always want to draw up the R, regular insulin first, then the NPH, the R, then the N. And remember, as an RN, a registered nurse, the R's come before the N's. So RNs draw up regular, then NPH. And Humulin is a mixture of R and N. And the 70 is the N, and the R is the 30. So it's 70% NPH and 30% regular insulin. Right? And the advantage of the Humulin is that you don't have to draw up two different types of insulin into the same syringe. Now, in the facilities where I work, the NPH comes up from the pharmacy in pre-filled syringes because you're not giving NPH to a lot of different patients, so it's kept in the pharmacy and comes up individually based on the prescribed dose for each individual patient. And then the regular insulin is kept on the unit, and we draw that up on our own. Now let's talk about injections and selection of the appropriate needle size for different types of injections. So if you have to give an IM injection, so an example on the NCLEX might be, the nurse has been tasked with administering an IM injection of some medication. Which size needle should they select? Well, an IM injection, the I kind of looks like a 1. So think of a 1M, and you'll see that the 1 is in both the gauge, the 21 gauge, and the 1-inch size. And for sub-Q, the S kind of looks like a 5, so 5Q. And the appropriate needle size for a sub-Q injection or a 5Q injection has both a 5 in the gauge and in the inch size. Okay, so you'll notice that the I's and the 1s look the same, and the 5s and the S's look the same. I used this just the other day when I had to draw up an IM injection for a psych medication. And typically at my facility, a lot of the IM injections already come up in pre-filled syringes. So almost everything that we're drawing up on our own and grabbing a loose needle is a subcutaneous injection. So I didn't remember off the top of my head what size needle to use. And then I remembered it's an IM. And the eyes look like a 1, so I selected the 21 gauge and went with the 1-inch needle. Actually, I used a 1.5-inch needle because we didn't have 1-inch needles, but, hey, use critical thinking here. If the NCLEX only offers 21 gauge 1.5-inch needle, are you going to select it? If the 1-inch needle is not available, then yeah, you will, right? Because you don't have to stick the entire needle into their arm or into their vastus lateralis. So use your critical thinking, all right? On to blood thinners, heparin and Coumadin. I just want to talk about the differences between these two drugs briefly. Heparin is given IV or subcutaneous, okay? So you could have heparin in an IV drip that gets titrated based on some labs that we'll talk about here in a minute, or it can be given subcutaneous. And we're also going to talk about Coumadin, which is also called warfarin, and it's given PO only, so you take that only by mouth. Now, heparin has a fast onset, so it starts working pretty quickly, and patients can take heparin for about 3 weeks, max use, maybe like 21 days is kind of typical, before they'll be converted over to something else. For these patients who are on heparin, we're going to want to monitor their PTT, and normal range for that is 25 to 35. And a good way to remember that PTT is associated with heparin, somebody taught me that the T's, when they come together, if you draw lowercase t's, the T's come together and it kind of looks like an H. So the H for heparin has the double T's that can look like an H if they're lowercase. It's a class C drug in pregnancy. So you want to be aware of that if you're working in labor and delivery, or if your client on the NCLEX has a description that they are pregnant. And remember on the NCLEX that These people are called clients, okay? They're not called patients on the NCLEX, so you'll hear me refer to them as clients or as patients in this lecture series, but it's the same thing, okay? A client is a patient. A venous access device is an IV, all right? It could be a PICC line. It could be a peripheral IV that was placed by a nurse. So those are examples of venous access devices. Now, for heparin, there is an antidote, and it is protamine sulfate. Protamine sulfate is the antidote for heparin. So if somebody has a PTT that's dangerously high, then you might see an order for protamine sulfate to counteract the effects of the heparin. Now, Coumadin or warfarin, as I mentioned before, it's given PO only, and unlike heparin, it has a slow onset. So heparin kicks in fast, Coumadin kicks in slow. About 5 to 7 days it starts working. And this is a drug that these patients can take for a lifetime. Patients who are on Coumadin or warfarin for their entire life. For this, instead of monitoring the PTT, we're going to monitor the PT-INR. And the normal range for that is 2.0 to 3.0. It is a class X for pregnancy, and the antidote is vitamin K. And I see that on a lot of tests for what is the antidote for Coumadin or warfarin. And the way they will assess what you know about that is they'll ask you what food choices would be inappropriate, or what should you be teaching the patient about their diet who has been prescribed Coumadin or warfarin. And vitamin K is found in dark green leafy vegetables. So I live in the South, and we got patients that eat a lot of collard greens. So I always teach my patients to make sure that they're just aware of the amount of collard greens or greens that they're eating, because it's going to counteract the effects of their Coumadin, and their blood will be clotting faster than anticipated. So you always want to teach them, watch the amount that they're eating. A little bit here and there, not a big deal, but they don't want to be eating lots of collard greens or spinach, dark green leafy vegetables every day. Okay, on to diuretics. There's two main classes of diuretics. There's potassium wasting, and there are potassium sparing. So you got to know which ones go in which categories. The good news is that drugs ending in X are all potassium wasting. There's one exception, and it's diuryl. But everything else, all the drugs that end in X are potassium wasting. So Lasix, Bumex, right? Those are potassium wasting diuretics. There's a group that is the potassium sparing diuretics, and that's everything else. So if they give you a diuretic, and they'll give you the generic name and the brand name of the drug, look at it to see if it ends in X or if it's diuryl. And if it's not, so something like spironolactone or anything else that doesn't end in X or is diuryl, then it's going to be potassium sparing. Mm-hmm. So those are a couple tips and hints that you can use for addressing medication related questions on the NCLEX. And you really want to know the diuretics, and you really want to know your blood thinners, because those are drugs that everybody else knows, and as a result are typically easier questions because lots of people are getting them correct. So make sure that you know insulin for the NCLEX, make sure you know your blood thinners, make sure you know your diuretics, and then make sure you know which size needle to select. And that will wrap up medication tips and hints.